How to prevent gout naturally. How to prevent gout sufferers. Most people have heard of gout, but I suspect many don't know what it really is. Simply put, gout is a disease caused by excessive levels of uric acid in the bloodstream, hyperuricemia. Not everyone who has high levels of this acid their blood develops gout disease, but it does seem most do. Specifically, gout occurs when uric acid crystals form around body joints like knees, fingers, elbows and especially big toes. In fact, for the vast majority of gout sufferers, the first sign of the disease is big toe pain. After salt-like crystals form, inflammation, tenderness, and even a reddish rash may occur around affected joints. The disease has been noted and documented since the time of Hippocrates. Traditionally, it's been associated with exuberant living, eating and drinking well. And there is some indirect evidence to support this. For example, a long-term study noted that heavy consumers of meat and seafood were much more likely to develop gout. Additionally, significant alcohol consumption, especially in the form of beer, is also known to increase the risk of gout development. Below are simple home remedies that may help to relieve pain and other symptoms linked to this sometimes debilitating disease. It's unlikely they will all work for or apply to you, so it may be worth experimenting with different remedies to find the ones that personally help alleviate your symptoms. An old study supported by a recent one and significant amount of anecdotal stories suggest drinking cherry juice may help alleviate pain caused by uric acid crystal formation. Soaking the affected joint or joints in warm water, or having a warm bath, may also help. Drinking plenty of water may help eliminate uric acid from the body. Cutting back on alcohol and meat, especially red, consumption should reduce the level of digestive purines from which uric acid is formed. If you're overweight, slowly losing weight may also help. A recent study suggested taking vitamin C supplements may reduce the risk of gout attacks, so this is worth considering too. Due to improper diet, sedentary lifestyle and obesity, many people suffer from gout these days. Gout predominantly affects men and the disease is most likely to occur at a more advanced age. Men with ages over 50 usually develop forms of gout. In some cases, women can also develop the disease after the age of 60. There are many factors that facilitate the development of gout, but the actual cause of the disease seems to be the body's excessive secretion of a substance called uric acid. Uric acid is a residual product that is excreted from the body through urine. The surplus of uric acid inside the body leads to its accumulation in the form of uric crystals. These crystals deposit in different regions of the organism, causing inflammation. Gout mainly affects joints, especially those of the lower body limbs. Gout causes inflammation, swelling and intense pain of the affected areas. Although the disease can be corrected through an appropriate gout treatment, there is no specific cure for it. Many medicines prescribed for gout usually control its symptoms, rather than the actual causes. However, some of the causes of gout can be overcome through the means of a good, healthy diet. It is very important to reduce the consumption of alcohol when suffering from gout, as it interferes with renal activity. Smoking is known to cause damage to arteries and it can also slow down the process of healing. Gout usually involves intense pain of the joints. Pain episodes tend to become more intense during the night and sometimes people with gout have trouble sleeping. Although some medicines don't prevent pain attacks from reoccurring, they are effective for temporarily reducing it. common medicines prescribed in gout treatments are non-steroidal anti-inflammatory drugs, indomethacin, ketoprofen, diclofenac, ibuprofen, and naproxen. They are efficient in calming the inflammation and also ameliorate the pain. Anti-inflammatory drugs are usually well tolerated by the body. They are administered orally, in the quantities prescribed by the doctor. Another substance used in gout treatment is colchicine. Although it considerably reduces pain and discomfort of the regions affected by gout, it also has a lot of side effects. Due to this fact, colchicine is only administered to patients suffering from acute gout or to those who don't respond well to gout treatment with non-steroidal anti-inflammatory drugs. Corticosteroids are also used in some gout treatments. They quickly relieve the pain and they can usually be injected directly into the affected joint. However, they are used only in extreme cases, due to their multiple side effects. Although proper diet and drinking larger quantities of water are a natural way of getting rid of the surplus of uric acid from the body, some medicines can also help to normalize the levels of the substance. Such medicines are usually used in chronic gout treatment. Allopurinol is an inhibitor that decreases the quantities of uric acid secreted by the body. Uricosuric agents like probenecid and sulfonpyrazone improve the activity of the kidneys, aiding the process of excretion. Many symptoms of gout can be ameliorated by following an appropriate gout treatment. However, when suffering from chronic forms of gout, the symptoms reappear after certain periods of time and ongoing treatment is necessary. The signs of gout and gout symptoms. Gout is a type of arthritis that causes the inflammation of the joints. Gout mostly affects the joints of the lower body, toes, heels, ankles, knees, but it can also affect other joints, elbows, spine, shoulders and wrists. The disease can sometimes cause damage to skin and soft tissue, tendons and muscles, which have decreased flexibility and integrity. The most common gout symptoms are discomfort, sourness, swelling and intense pain of the affected area. In most patients with the disease, the first gout symptoms appear at the level of the big toe. The skin around the affected regions turns yellow, appears to be stretched and bruised. People who suffer from gout usually experience pain attacks that may last anywhere from a few minutes to a few hours and in some cases, even days. In most cases, the pain attacks seem to amplify at night and many people with gout have trouble sleeping. The regions affected by gout become very sensitive and people with the disease can't tolerate clothing or shoes. Gout is mainly caused by the accumulation of uric acid, waste product that is collected and eliminated by the kidneys through urine, inside the body. The surplus of uric acid tends to crystallize and deposit in different parts of the body. One of the most disturbing gout symptoms is the inflammation of soft tissue. Sometimes, the crystallized uric acid forms tophi, painful lumps under the skin. Sometimes, tophi may even tear up the skin, causing infections. Gout symptoms can be ameliorated by diet and lifestyle. Keeping a proper diet is a good way of handling the effects of the disease. In some cases, good diets are even more effective in overcoming gout than the actual treatment prescribed for the disease. The treatment of gout usually deals only with local inflammation and pain, and its effects are temporary. Pain episodes and inflammation are known to reoccur even under intense medication. A good diet, however, eases gout symptoms and also minimizes their chances of reappearing. Gout diets consist mainly of low-purine foods that don't add to the amount of uric acid in the body. By drinking plenty of water, you help the kidneys excrete the surplus of uric acid. Around 2 liters of water each day are required. Gout symptoms also tend to amplify in the case of people who are overweight. Obesity is known to facilitate the accumulation of uric acid inside the body. Also, overweight people that suffer from gout are more exposed to injuries of the joints. It is very important to try losing the extra weight when suffering from gout. Smoking and the consumption of alcohol are considered to be factors that support and aggravate gout symptoms. Alcohol interferes with the normal renal activity, causing the kidneys to release less uric acid through urine, while smoking seriously damages arteries, affects blood circulation and slows down the process of healing. When suffering from gout, it is very important to reduce these factors of risk, as they only cause damage to the body.